China's taken a lot of criticism for its response to COVID-19. But the fact is, what if COVID-19 had emerged in Chad, which has 3.5 doctors for every 100,000 people? What if it had emerged in the Democratic Republic of Congo, which just released its last Ebola patient from treatment? The truth is, countries like this don't have the resources to respond to an infectious disease, not to treat people, and not to report on it fast enough to help the rest of the world. I led an evaluation of Ebola treatment centers in Sierra Leone. And the fact is, the local doctors in Sierra Leone identified the Ebola crisis very quickly. First as a dangerous, contagious hemorrhagic virus, and then as Ebola itself. But having identified it, they didn't have the resources to respond. They didn't have enough doctors, they didn't have enough hospital beds, and they didn't have enough information about how to treat Ebola or how to implement infection control. 11 doctors died in Sierra Leone of Ebola. The country only had 120 when the crisis started. By way of contrast, Dallas Baylor Medical Center has more than 1,000 physicians on staff. These are the kinds of inequities that kill people. First, they kill the poor people when the outbreaks start, and then they kill people all over the world when the outbreaks spread. If we really want to slow down these outbreaks and minimize their impact, we need to make sure that every country in the world has the capacity to identify new diseases, treat them, and report about them so they can share information. COVID-19 is going to be a huge burden on health systems. I'm not going to talk about death rates in this talk because frankly, nobody can agree on the COVID-19 death rates right now. But one number we can agree on is that about 20% of people infected with COVID-19 are going to need hospitalization. Our US medical system can just barely cope with that. But what's going to happen in Mexico? COVID-19 has also revealed some real weaknesses in our global health supply chains. Just-in-time ordering, lean systems are great when things are going well. But in a time of crisis, what it means is we don't have any reserves. If a hospital or a country runs out of face masks or personal protective equipment, there's no big warehouse full of boxes that we can go to get more. You have to order more from the supplier, you have to wait for them to produce it, and you have to wait for them to ship it, generally from China. That's a time lag at a time when it's most important to move quickly. If we'd been perfectly prepared for COVID-19, China would have identified the outbreak faster. They would have been ready to provide care to infected people without having to build new buildings. They would have shared honest information with citizens so that we didn't see these crazy rumors spreading on social media in China. And they would have shared information with global health authorities so that they could start reporting to national health systems and getting ready for when the virus spread. National health systems would then have been able to stockpile the protective equipment they needed and train healthcare providers on treatment and infection control. We'd have science-based protocols for what to do when things happen, like cruise ships have infected patients. And we'd have real information going out to people everywhere so we wouldn't see embarrassing, shameful incidents of xenophobia, like Asian-looking people getting attacked on the street in Philadelphia. But even with all that in place, we would still have outbreaks. The choices we're making about how we occupy this planet make that inevitable. As far as we have an expert consensus on COVID-19, it's this. Here in the US and globally, it's going to get worse before it gets better. We're seeing cases of human transmission that aren't from returning travel, that are just happening in the community. And we're seeing people infected with COVID-19 when we don't even know where the infection came from. Those are signs of an outbreak that's getting worse, not an outbreak that's under control. It's depressing, but it's not surprising. Global health experts, when they talk about the scenario of new viruses, this is one of the scenarios that they look at. We all hoped we'd get off easy, but when experts talk about viral planning, this is the kind of situation and the way they expect the virus to move. I want to close here with some personal advice. Wash your hands. Wash your hands a lot. I know you already wash your hands a lot because you're not disgusting, but wash your hands even more. Set up cues and routines in your life to get you to wash your hands. Wash your hands every time you enter and leave a building. Wash your hands when you go into a meeting and when you come out of a meeting. Get rituals there based around hand washing. Sanitize your phone. You touch that phone with your dirty, unwashed hands all the time. I know you take it into the bathroom with you. So sanitize your phone and consider not using it as often in public. Maybe TikTok and Instagram could be home things only. Don't touch your face. Don't rub your eyes. Don't bite your fingernails. Don't wipe your nose on the back of your hand. I mean, don't do that anyway, because gross. Don't wear a face mask. Face masks are for sick people and healthcare providers. If you're sick, your face mask holds in all your coughing and sneezing and protects the people around you. And if you're a healthcare provider, your face mask is one tool in a set of tools called personal protective equipment that you're trained to use so that you can give patient care and not get sick yourself. If you're a regular healthy person wearing a face mask, it's just making your face sweaty. Leave the face masks in stores for the doctors and the nurses and the sick people. If you think you have symptoms of COVID-19, stay home, call your doctor for advice. If you're diagnosed with COVID-19, remember it's generally very mild. And if you're a smoker, right now is the best possible time to quit smoking. I mean, if you're a smoker, right now is always the best possible time to quit smoking. But if you're a smoker and you're worried about COVID-19, I guarantee that quitting is absolutely the best thing you can do to protect yourself from the worst impacts of COVID-19. COVID-19 is scary stuff at a time when pretty much all of our news feels like scary stuff. And there's a lot of bad but appealing options for dealing with it. Panic, xenophobia, agoraphobia, authoritarianism. Oversimplified lies that make us think that hate and fury and loneliness are the solution to outbreaks. But they're not. They just make us less prepared. There's also a boring but useful set of options that we can use in response to outbreaks. Things like improving healthcare here and everywhere, investing in health infrastructure and disease surveillance so that we know when the new diseases come, building health systems all over the world, looking at strengthening our supply chains so they're ready for emergencies, and better education so we're capable of talking about disease outbreaks and the mathematics of risk without just blind panic. We need to be guided by equity here, because in this situation, like so many, equity is actually in our own self-interest. So thank you so much for listening to me today, and can I be the first one to tell you, wash your hands when you leave the theater.